Hello, I'm Lexington County Sheriff Koon. As the calendar turns to fall, I want to talk to you a little bit about suicide awareness and prevention. Statistics tell us as we approach Thanksgiving and Christmas, two of the most family-oriented, socially active holidays, that we see an uptick in suicides and suicidal tendencies. Now, we've come a long way in our business to address these issues. We receive better training. We have mobile crisis teams to actually come out and help us on scene. But still, we deal with more and more of these situations. Sometimes we're called and a suicide is already completed and there's someone that's deceased on scene. Many times we get called and somebody is in crisis and we have to mitigate that. And on occasion we've been called where somebody on scene with suicidal tendencies will do something aggressive towards law enforcement, which requires us to use deadly force, commonly referred to as suicide by cop. All these are very tragic, and when the situation concludes, there's a large void left in the family, in the community, more questions than answers. Typically what happens is our county dispatch will receive a call from sometimes the individual that's in crisis. They will maybe call a suicide prevention line, crisis line. Sometimes they call 911 themselves, but more often than not, we get it from a third party, a family member, a coworker, somebody that cares about this person will say, I have an individual that's in crisis. They made suicidal threats. They're not acting quite right. Something in their life has changed to really cause them to be in a dark place. Our number one priority is to locate that person and get them the help they need. Dispatch will try to get as much information as possible. Their whereabouts. Do they have access to any weapons? Have they ingested anything that may cause them harm? Law enforcement uses all means to locate this person. Sometimes they are at a known whereabouts, someone's house. Other times they've left. They're maybe at a place that has a special meaning. We found people in the middle of the woods, in cemeteries where maybe a grave of a loved one is. Sometimes we found them in the middle of the lake in a boat. But many times the folks are riding around, just in a vehicle, trying to get their thoughts together. Law enforcement uses all means necessary. We've used canines, drones, all available technology to locate these folks. When they're located, law enforcement are trained to assess the situation immediately. Start seeing what's going on. Trying to calm the situation down. Now, we found it to our advantage to try to get somebody that's familiar with a person. Maybe an officer that's been on a call with them before, maybe an acquaintance, something to calm down the situation, to get their mind off of these suicidal tendencies, to talk about positive things in their life, maybe family or friends or reasons they should not harm themselves. And if the situation meets a certain threshold, we call EMS. Usually that's when something physically is obviously wrong with the person. We're worried about their well-being. We don't know what they may have ingested or taken or what kind of harm that is a ticking time bomb inside of their body. Time is not on our side in these situations. So when the scene is what we call secure, EMS comes to help us handle the situation. And during the time that it takes the EMS to ultimately arrive, we're talking to these folks, trying to get their mind off the situation at hand. When EMS arrives, they will take the individual to the hospital, where they will further get assistance, both by mental health professionals and medical doctors. And if they see fit, they will do what's called a Part 1 evaluation, where they will get further mental evaluation, ultimately, hopefully, get in a treatment program. Now, the good news is we've had some successes. We have people that have been in a very dark place, ready to harm themselves, that have reached out for help and got the treatment they needed, and now they are in a better place. They're productive back in the community. So certainly, while we remember the loss, we want to celebrate the successes. We have a unique opportunity coming up on October 22nd, the Out of the Darkness Walk, sponsored by the American Foundation for Suicide Prevention, will be held on Sunday afternoon at Riverfront Park here in Columbia. So we encourage you to come out and join others that may have lost somebody, to remember those folks, but also celebrate the people that have overcome the situation. So as a community, as we get closer to Christmas and Thanksgiving, if you know of somebody that has gone through a change, that have grieving a loss of a loved one, maybe had a recent change in a relationship, a job status, reach out and check on these people. Let them know there is help, there is a way out. And certainly, if you're one of those individuals that are in a dark place and really feel like harming yourself, know that there is help for you. There are people just like you that have reached out for help, that have got the help they need and are now back productive citizens. I do believe that us all working together, we can certainly make a difference. Thank you.